Good day, I'm Maris A. Giao from BSN 22 Group 2, and today I will be performing the application of cold therapy. So the purposes of this procedure are to stop or to slow bleeding, slows bacterial activity in patient with infection, and then reduces swelling in injured tissues, including sprains and fractures. So for the assessment, identify the patient using at least two identifiers or the name and date of birth of the patient. So hi ma'am, I'm Maris A. Giao, a student nurse from Tarlac State University. May I know your name ma'am? Your date of birth po? Okay, thank you ma'am. And then next, perform hand hygiene and inspect condition or affected part, and then palpate area for edema. So ma'am, I'm going to palpate the injured part. And then next, consider time elapsed since injury has occurred. So if it is more than 48 hours already, we can suggest to the patient the heat therapy. So if it is not, we will go on with the cold therapy. And then next, ask the patient to describe severity or character of pain. So, ma'am, on the scale of 1 to 10, 1 would be the lowest and 10 would be the highest. Gaano po kasakit, ma'am? And then, next, so the patient rated the pain 7. And then next, we will perform neurovascular check. We will inspect the surrounding of the skin for integrity, circulation, color, temperature, and sensitivity to touch. So, inspect the surrounding of the skin. Next, review medical history of the patient or that contraindicate the use of cold therapy. So, we will inquire if the patient has or had Raynaud's disease. So, why Raynaud's disease? Because it is a peripheral vascular disorder which makes the blood vessels become more sensitive to cold temperature. So, ma'am, any history of Raynaud's disease po? Okay, none po. Okay, thank you, ma'am. And then, next, assess the patient's level of consciousness and responsiveness, and then assess for the patient's understanding and awareness of the procedure. So, ma'am, any questions po or clarifications before we start? Okay, wala naman po. Thank you, ma'am. So, for the planning, identify expected outcomes or the therapeutic effects of cold therapy, which are the increase in viscosity, increase muscle tone, and decreased blood flow. And then prepare the equipments and supplies, which are the basin, towels, and then the ice pack. And then next, explain the procedure and precautions to the client. So, ma'am, cold therapy po tayo ngayon. Medyo malamig po ito sa pakiramdam, pero pag hindi na po kaya, sabihan niyo po ako agad para mag-stop po tayo. Okay lang po yun, ma'am? Okay po, thank you, ma'am. And then next, for the implementation, provide privacy for the client by closing the doors and drawing curtains. And then next, perform hand hygiene. And then apply clean gloves. And then position the patient properly, expose the area to be treated, and drape the patient with blankets. So since the injured part is this sprain, is the wrist sprain, we will not have to do that. And then next, for the and then place towel or pad under the area to be treated. So here. And then for the application of cold compress, place ice water in the basin. And then test temperature, so the water should be cooler than the skin of the patient. And then submerge gauze into the basin and then wring out excess moisture. And then apply the compress to the affected area. And then mold oversight. And then remoisten, and then reapply to maintain the temperature as needed. And then next, apply ice pack or bag. For the application of ice pack and bag, fill bag with water. Fill bag with water. And then secure cup, and then invert bag. So if wala pong tumutulo, okay po siya. And then empty the ice pack or bag. And then fill the ice pack with ice chips and water. And then secure cup, and then express for excess air from the bag. And then secure cup closure, and then wipe the bag dry. And then squeeze or knead commercial ice pack. Next, wrap the pack or bag with towel, and then apply over the injured part. And then secure tape as needed. And then next, apply the commercial gel pack. Remove from freezer, wrap in towel, and then apply over injury, and then secure with tape and gauze as needed. So next is the apply electrically controlled cooling device. Prepare device appropriately, and then ensure all connections are intact and the temperature is set. And then wrap the cool water flow pad with towel or in pillowcase, and then wrap cool pad around body part, and then turn device on and set correct temperature. Secure elastic wrap, bandage, gauze roll or ties, and then remove gloves, dispose them properly, and then perform hand hygiene. And then check condition of skin at appropriate intervals. Use extra caution for area if edematous, and then assess site more often, and then stop if patient complain of burning sensation or the skin started to feel numb, and then apply clean gloves, remove compress or pad, and then at appropriate time, and dry any moisture. And then next, help patient to sit up in a comfortable position, and then remove and dispose all supplies and empty basin. Help the client in a comfortable position. And then remove and dispose all supplies. And then empty the basin and dry. Dispose soiled linens and gloves, and then perform again hand hygiene. For the evaluation, inspect affected area for integrity, color, temperature, and sensitivity to touch. Evaluate at appropriate interval, and then palpate affected area for edema, bruising, and bleeding. And then ask patient to report pain level, and then ask the patient also for or to demonstrate how to apply ice pack, and then identify unexpected outcomes, which are the complications of cold therapy, which are the pain, redness, and hypothermia. And then for the recording and reporting, record procedure and patient's response in the appropriate log, and then document evaluation of patient and or caregiver learning, and then report any sensation of burning and unrelief or numbness of the skin color changes to healthcare providers. And then that's all for the application of cold therapy. Thank you.